I've been a nurse at Temple Hospital for 29 years. And 29 years ago, I made a commitment to this community. And I stand here now just as committed to my patients and to my fellow workers as I did all those years ago. I am extremely just appalled at how we've been treated. Like second-class citizens, like, you know, we're the enemy here, and we're not. And it's not about money. It's about some dignity and respect and doing a good job at taking care of people that need us.
The main concern for me is safe staffing, that we have adequate amount staffing for our patients, and that we're able to give that patient care one-on-one that the patients deserve. And now that they're trying to take that away from us, it's not fair.
It's really a shame when nurses are pulled for 4 hours from one unit to the next, have to get report on 8 patients, go back, get pulled to another unit. It's so unsafe and it's unfair. It's not fair to the nurse, but it's definitely not fair to the patient or their family members.
1,500 Temple University Hospital nurses and staff will be going on strike on Wednesday, March 31st. Faced with the stripping away of their rights as human beings and as healthcare professionals, they have no choice but to go on strike to demand justice for themselves and their patients. After 5 months without a contract, Temple's offer would dramatically reduce their ability to give quality care by taking away their right to advocate for patients. It would increase their healthcare costs, strip away tuition benefits for family members attending Temple University, and includes wages that do not reflect increases in the actual cost of living.
We see that they really don't care about us. They don't care about our patients that we care for. Because if they did, they would take the opportunity to sit down and talk with us and make sure that we come up with an equitable contract.
We are the ones that have our hands on the patients. We are the trusted people at the bedside. What Temple has to do is come back to the table and talk to the trusted profession.
Temple University Hospital is offering upwards of $10,000 per week per temporary worker. Many are questioning the logic of spending upwards of $15 million to hire temporary workers when they could negotiate a fair contract with their existing staff for a fraction of that cost. Many nurses have expressed a grave concern for their patients, who will be in the hands of much less qualified temporary staff.
Every day I go into this hospital. Sometimes I work 12 hours, sometimes I work 16 hours with critical care trauma patients. I advocate for my patients every shift, every hour, every minute. That's what I do.
Most of our patients come in not with one illness or 2, but often 3 and 4. Those comorbidities make it really difficult and complex to take care of our patients. And that is why it's important to have qualified, dedicated, experienced staff.
They have forced you to take to the streets, and you cannot let those patients down. I cannot tell you how proud everybody across this country is of you.
A lot of people are saying they're not prepared. They're a little afraid. What are they going to do without that paycheck? We have to stand together. It's not just about money. It's about the respect, the dignity.
During negotiations on March 15th, Temple's Vice President of Human Resources made a remark that clearly reflects Temple administration's regard for human rights.
Bob told us that we, as employees here, we want our constitutional rights. We need to go someplace else. Where are we going? Nowhere! This is where we work. We are not going anywhere. We have been here, 10 plus years, and we're not going anywhere.